On debate, Senator Deacon, Nova Scotia.
Thank you, Speaker. Colleagues, I rise tonight to speak to Bill S-253, an act respecting a national framework for Fetal Alcohol Spectrum Disorder, or FASD. I stand in strong support of Senator Ravalia's bill, and am personally grateful for his initiative. Immediately prior to my appointment to the Senate, I was a director and incoming chair of the Kids Brain Health Network, which supported the mobilization of research related to autism, FASD, and cerebral palsy. It was in this capacity that I first began to learn about the shocking realities associated with FASD and the isolation, risks, pain, and trauma that it visits on so many children and their families. My remarks today are focused primarily on 4 points. First, FASD is an equal opportunity problem, the consequences of which are made so much worse because of judgment and shame. Number 2, the current cost of inaction across the lifetime of a child born with FASD far, far exceeds every other intervention alternative. Third, early diagnosis and intervention are essential to reducing the lifetime costs. However, the vast majority of current evidence-based approaches and tools are unavailable to most families. And fourth, remote delivery options hold important promise and the opportunity for Canada to lead globally as we work to address the needs of children, families, and educators, and so many others affected by FASD are substantial indeed. So to my first point, FASD is an equal opportunity problem. In Canada, approximately 70% of women of childbearing age drink, and 50% of pregnancies are unplanned. We know from various epidemiological studies that about 30% of pregnancies are alcohol exposed to some degree, and most often during the first trimester, before the woman even knows she's pregnant. A recent University of California, San Francisco study found that 1/3 of women discover that they're pregnant at 6 weeks or later. This rises to almost 2/3 of younger women, and marginalized women are even more likely to discover pregnancies past 7 weeks. Simply, in committee, I think it will be important to understand the degree to which judgment and shame actually discourage versus encourage willingness to access early diagnosis and treatment for FASD in those places where it is actually even available.